my name is Verna and I'm from South Africa. We have a lot of problems with our healthcare system. As you know, South Africa used to be under an apartheid regime, which was really bad. But one of the things that was interesting in that regime is that there was a good system of, well, not good, problematic system of healthcare, but there were really good hospitals. So money, the regime money was being spent on hospitals. And since our government has changed, not as much money has been put into healthcare. So we are now all equal, but the healthcare is very problematic because it's become that if you've got a lot of money, you can go to private healthcare, but if you don't have a lot of money, you've got to go to government healthcare, and the government haven't been putting money into the healthcare system to keep it up. So even though everybody was oppressed under the apartheid regime, even though there was such oppression, when you were ill you could get good health care, and now you have to be rich to get good health care. So it's really weird because it's changed from a system of like political, racial oppression to a system of financial oppression, and that's what's happened in our health care, and I'm really worried that only people with money get good health care.
What do you think could be done to improve that or change that?
I think that government doesn't realize how important healthcare is, because all the people in government have a lot of money, so they can go to the private healthcare systems. So I think that what has to be done to change that is that, I mean, just the realization of how important it is for everybody to get decent healthcare across the board, regardless of because it's no longer a race issue in South Africa anymore. It's your social status, your financial status. So everybody deserves good health.
Okay, well, my name is Maria.
My name is Henrik.
And this is our son, Nils, and we're from Sweden. The health system in Sweden is not like this, I would say. It's a bit different. We have we pay high taxes in Sweden,
yeah.
Which means that we get really good health care, I would say. And it's not that, I mean, it's pretty much free.
Free healthcare.
Yeah, we have free healthcare for everybody, and of course when we come to...
But it can also be long waiting times.
Yeah.
Sometimes, yeah.
Yeah.
Because of that.
Yeah.
Because it's, everyone gets the same benefits.
Yeah, exactly. It doesn't matter if you're rich or you're poor, you should have the same benefits as anyone in the country.
Yeah.
It's really critical, you will get moved forward, but still it's such a high pressure on the hospitals and stuff like that. So even if you have like a procedure that should need to be done today, maybe it will take a couple of weeks, but still, I mean, if it's life or death, you'll do it at once, of course.
Yeah.
But if someone needs transplant or cancer and should do an operation, then it can take a while.
Yeah.
But I would say it's pretty fast in Sweden. You don't need to have a work. I mean, everybody can go to the hospital, and it's a minimum fee that you pay that like everyone can pay. If you can't pay it, then the social services will help. But I would say in Sweden it's really good. I would say we pay high taxes so that we can help everyone.
My name is Francisco, and I am from Mexico. Well, health means living a life with a good condition and enjoyment to be able to live it fully. Well, definitely keep the water sources clean, and certainly an environment where the children can grow and play. So a lot of green areas, preservations, yes.
Hello, my name is Miriam. I'm from Spain. In my country, the medicine is free. All the health is free in Spain. So it's great for us.
Thank you.
My name's Tim Ducey, and I'm from Tunbridge in Kent in England. Health means to be well and to be able to live life without any have illnesses and stuff that's happening to you managed by healthcare within the country that you live.
What kind of healthcare system do you have in England?
We have the National Health Service.
Is it working out? How do you feel about it?
Well, it's quite controversial because people feel that it's underfunded and it's overstretched, and there's too many calls on it, particularly with aging population and big issues around social care and mental health, and people feel that the system is at stretched and at breaking point.
Do you have any solutions to any of the issues to fixing the healthcare system?
The solutions to it are going to be about putting more money into the system and to increase what people are paying in their taxes.
My name is Anir, I'm from Egypt.
What kind of healthcare system do you have?
When someone gets sick, you simply go to the doctor you want. It doesn't have to be a certain system. You pay them in cash, and that's it.
Do you like that system?
It's not that bad because it's not that expensive in Egypt to go to a doctor and pay him in cash full price. It's not that expensive over there. And there are many doctors there, the cheap ones there, the more expensive ones, so it's not that bad. It's not like the US. If you go to a doctor, if you don't have health insurance, you would go bankrupt.
I'm grade school from China. Healthcare is like a human right, and government needs invest more for improve citizens' healthcare and well-being.
My name is Christine Morland. I live in Aberdeen, Scotland, the UK. We have a tremendous national health service, and I mean everything is free, and we have a really back to the basics of general practitioners. They in turn, will send us through to consultants in the hospital, but everything is free, and we have we can't fault it really. In Scotland it's a little different from England, but in general everybody is putting money into the system, so it should improve for times for people having operations and the like. And when you are involved with the GP, there might be a slight time frame before you actually go to see a consultant in the hospital, but they're bringing now down those times, so in that respect we're coming down to hours rather than, well, when I say hours, minutes into an hour. So but really we can't compare our health service to the health service here. It horrifies me what my son has to go through, although when he's been through to hospital it's very thorough. I will say they check everything from top to toe here, whereas they do it in stages in the UK.
My name is Sonali and I'm from India, studying here in New York. So yeah, healthcare in India is it's simpler than what it is in New York. I mean, we can go to the hospitals easily. We don't have to wait in lines and follow procedures that much. Although there are some, like you have to sign some papers and everything, especially when there are cases of accidents. Yeah, but otherwise I think it's simpler. And also for the pharmacies, I think it's very easy to get medicines. Here it's very difficult. Like if I want a painkiller also, I have to search for it. Sometimes I need a prescription for it. In the US, I think they should be quicker than what they are right now. I mean, the process is so lengthy and it's so it has so many things involved that I think the exact procedure takes a lot of time. You have to go through so many things to finally reach there, and because of this I think a lot of people, especially in emergencies, I mean they face problems and they're not treated at that moment. So yeah, I've been to emergency twice here, and both the times I had to wait for so long.
How long has you waited here?
I have waited for like 3 hours to finally get the medicine that I wanted.